I am very pleased to announce that following extensive consultations with school boards, superintendents, parents, and teachers, Alberta's K-12 education system will reopen for in-class teaching this September, and 750,000 students will be able to return to school. Our health and education officials have closely studied the experiences of other provinces and countries, and together they've developed state-of-the-art protocols for minimizing the risk of transmission at schools. This does not mean there will be no cases in schools. It means rather that we have calculated the relative risks of reopening against the risks of continued closures, and we've made the best decision to serve the public interest. Throughout the pandemic, Albertans have consistently demonstrated great responsibility, doing their part to contain the spread and protect the vulnerable. I'm confident that everyone in the school system will do their utmost to follow the comprehensive public health guidance that Alberta Health has developed for schools.
The most common question that students, parents, and staff have right now is probably, how will we keep schools safe? As a parent of young children, I know this is top of mind for all of us who have direct connection with the school system. I want to stress that there is no risk-free approach to living with COVID-19, yet we still have to learn to live with it. There are no easy choices in front of us. Several public health measures will be put in place to protect everyone in class and to protect their families and cohorts outside of school. The new measures will require students and staff to monitor symptoms on a daily basis and stay home if they are feeling sick. Students must wash or sanitize their hands before and after entering school and classrooms. Surfaces at schools and on buses will be disinfected more often. Students and staff may choose to wear a mask and should be supported in choices to do so. We recognize how difficult masking would be for many students, especially at the lower elementary grades, which is why we are not relying on any single public health measure to stop the spread of COVID-19 in the school setting. Other practices, such as physical distancing, cohorting, frequent hand washing, enhanced cleaning, and a number of changes as to how classes and schools operate will also help. Keeping students in cohorts will help reduce the risk of widespread transmission by limiting contact and potential exposure to a small group rather than the entire school. Everyone in the school community will have to do their part and follow public health guidance to keep each other safe. This means that parents, students, and staff will be required to complete a daily self-screening prior to entering school each day. If a student shows symptoms while at school, they will be separated from others, and parents or guardians will be asked to pick them up immediately. If there is a case of COVID-19 in a school or school community, health officials will work with school authorities to ensure follow-up testing is conducted as needed, and all other measures are put in place to limit the spread, including quarantine of those who were in close contact with that case. Jurisdictions around the world are trying to determine the most effective ways to resume schools. We continue to watch their experiences closely. In the days ahead, we will continue to refine our public health advice for schools based on best available evidence to minimize the risks of staff and children being exposed. This is part of living in the new normal of COVID-19. We must be agile, adaptive, and guided by the evidence as it emerges. This is the best way to protect the health, safety, and well-being of students, staff, families, and communities.